Very good morning, one and all. So I'll be presenting the results of a trial. It's a multicentric randomized clinical trial where we actually evaluated the effect of Phaco position on corneal endothelial cell loss over a period of 1 month. So this was funded by Wellcome Trust DBT India Alliance Fellowship Grant. The slides are not shifting. So minimizing corneal endothelial cell loss is very important and essential for optimizing visual outcomes. Studies have shown that bevel down phaco is advantageous as it reduces phaco time by 30% because of effective spatial contact between the lens fragments and the phaco tip with no additional risk for PC rend. But the effect of this technique on corneal endothelial cell loss has not been effectively studied. Although there are few studies which have done this, there are methodological issues with inconclusive results. So this is what we wanted to study, the effect of phaco tip position on corneal endothelial cell loss with the two techniques of bevel up and bevel down phaco tip phaco emulsification on corneal endothelial cell loss. And that was our primary objective. The secondary objective was any differences in the central corneal thickness at day 1, 15 and 30, and also safety regarding intraoperative complications. So we included patients more than 18 years of age, and we excluded few patients with regards to pupil size, smaller pupil size and lower endothelial cell counts. And the intervention was bevel up or bevel down phacoemulsification with clear corneal incisions. And during the nucleus management procedure, the phaco tip was kept in the position which they were assigned to. Only in a few cases, the engagement of the fragments were allowed in tilted position, but the emulsification as such took place in the assigned position. We recruited 480 participants, and a triple masking was done. That is, a participant, outcome assessor, and data analyst was blinded to the procedure. We used intention to treat principle and the ANACOA test, that is, analysis of covariance was done, where the baseline endothelial cell count preoperatively was adjusted for, and the central corneal thickness differences were assessed using a mixed effect model. This is the flow of participants, which is represented through a consort flow diagram. 241 participants were recruited for bevel up and 239 in bevel down, and at the end of follow-up, 20 participants in bevel up and 25 participants in bevel down were lost to follow-up. This is mainly during the COVID-19 pandemic. These are the differences in the baseline parameters of the population among both the study arms. There was no difference, basically indicating that the randomization happened accurately. Intraoperative parameters were also very balanced between both the trial arms. The primary outcome, which being the endothelial cell count at post-operative 1 month, was not statistically significantly different between both the trial arms. The endothelial cell loss percentage was 9.19% in bevel up group and 9.01% in bevel down group, which was not statistically significant. The central corneal thickness drastically increased on the first post-operative day, and it reduced over a period of 1 month, but the differences between the trial arms was not significant. We did a subgroup analysis where we tried to see if there is a difference in the interventions between those who have lower endothelial counts and those with harder cataracts, but we did not find any significant difference. Coming to the adverse events, which are intraoperative adverse events, both the trial arms did not show any significant difference in terms of intraoperative complications. So there have been several studies which have done the same trial before, but there were methodological issues. We assessed the quality of these studies using the ROB score, and we found that the previous two trials had some issues, mainly with respect to the sample size and the blinding of the trial. So where our trial stands robust is with the sample size calculation, with the robust trial design, and we used consort guidelines, which helps to mitigate the biases. However, we cannot generalize our results where majority of the cataracts are hard cataracts, because we have excluded the hard cataracts in our study, which was about around 11% of the cases. So we could say from this study that we can use either bevel down or bevel up position without any adverse outcomes on the corneal endothelial cell loss.